And hello, everyone, and welcome to Community Chats once again. I'm Sandra Arevalo. I'm going to be your host. I'm the Director of Community Health and Wellness at Montefiore Nyack Hospital. And today with us is Dr. Andrew Kovitz. You're welcome again to Community Chats. He's now one of our guest speakers. How you call that? Now you're not per diem.
Recurring.
Now you're like established.
Recurring visitor.
Correct, recurring. So thank you so much for being with us. And anything that we are concerned about children and their brains and development, he's the expert. So we're very lucky to have him because I don't know a lot of doctors that actually have your specialty. And that's a question that I have. Like, how did you become a what is a neurosurgeon, right? Like
six figures of debt and about 10 years of schooling. Was that your question? Oh, you meant, how did I choose to do it? Oh, okay.
No, that's my question, because I know how you chose to do it last time, but then you also specialize in children, correct?
Yes.
So you have to do first medical school, then neurology, and then pediatrics.
7 years of neurosurgery residency, and then a year of pediatric neurosurgery fellowship to subspecialize.
Wow. Okay.
So
let me tell you, I have a lot of hair for having done all of that. So
I have the gray, yes.
Well, no, but you still have a lot. I would have none if I had to go to school for that long. So thank you so much, Dr. Kovitz, for being with us. And I know that you're going to be talking about a very interesting topic today, which is children development, and to see if they're developing actually on time and the way that is expected. And you're going to be talking to us about some clues and how to find out if our children are falling behind and what to look for and what to do, especially, right? So welcome. And I know that you want to share your screen with us. There you go. We're seeing it. Go ahead.
So thank you very much for the invitation, Chandra. It's a pleasure to be here again. And I am, honored to talk to everybody. My name is Andrew Kovitz. I'm a pediatric neurosurgeon at Montefiore Medical Center and assistant professor of neurosurgery and pediatrics as well. Today, we're going to talk about developmental milestones. Is your child on track or not? Really, we're going to be looking at what's the normal development. And from the understanding of normal development, we'll understand when children may be falling off track, not meeting milestones by particular points in time. But we must always keep in mind a couple of things. One, the children that we have, the standardized timeline that we have for children is, again, an average. There's going to be children that develop slower, that develop later, and don't necessarily have any developmental issues. So we have to take that into account. There's a lot of variability, and everybody is very different. We also have to take in other medical conditions, other medical problems, other issues that the child may have. Maybe the child is unable to hear, and as a result doesn't speak well. And we don't necessarily call that a developmental delay. We have to just modify how we treat our children to understand really what's a delay and what's not. And by understanding what's normal, that's when we'll know whether there's a delay or not. So anybody on this call, anybody watching this video, you will become an expert on early childhood development, I assure you, by the time we're done with this call, this talk, because you'll be able to understand really a very broad idea of what's going on with patients, with children, how they're evolving over time, how their brains are evolving over time, and what we can do to intervene early if there is an issue that we do identify. So we're going to keep it into three broad categories. We're going to talk about cognitive development and milestones. How is the child thinking? How is their brain working? How are they able to produce language? How are they able to problem solve? This will be one domain that we'll look at. Then we're going to look at motor development. How are the children moving? How are they using their arms and their legs? How are they developing in that regard, from the ability to interact physically with the outside world. And then we'll look finally at social emotional development. How are they interacting within the social construct, within an emotional framework, to understand how they interact with their parents, with siblings, with other individuals in their environment. So we have to know that none of these components are dependent on themselves solely. They're all interdependent. They all have to rely on each other. On a child's cognitive development, being able to explore the world is going to depend on their motor control, their ability to move around, to grab objects in the environment around them, to walk around, to explore. All of these portions are going to be interconnected. And when one lags, there could be all three lagging. So we'll have to see them as not separate entities, but we will talk about them as separate entities just for this purpose of this talk. But really, everything is together. The child is a whole. The child has all of these components happening simultaneously. And really monitoring all three of these issues and their interconnection is going to be important, not only for the doctors, for pediatricians, but also for you, for parents, understanding when one lags behind, how is it affecting the other domains that we're looking at? And then what could be done? If there's developmental issues that arise, we need to find a cause, figure out why this could be happening, and then what we can do for early intervention to be able to help correct them, to support them, to really turn a negative situation back to positive and get them back on track. Also, if you do have questions, feel free to leave them in the chat. I'll be happy to answer them at the end. So just keep a running list as things come up. So as we talk about early childhood development, we need to think about this as a sequence of events that need to happen in time. They're very predictable from child to child. And as a result of this predictability, we're able to create this guideline and this framework within the milestone system to understand when things should be happening. And typically, as it just intuitively makes sense, the more complex behaviors are going to be preceded by more simple behaviors. Things are going to happen from closer to the body as they go outward towards the extremities, as we use the fine movements of our hands to be able to interact with the world. Things are going to go from more general, just reactionary to the environment, to more specific. The child has a goal. They want to do a specific thing. They want to have a precise reaction to an event. So it's always going to go from more general to more specific, from more kind of rough to more refined and more detailed as the child develops into the future. And these milestones, again, they just provide a framework. Some children will be in front of the milestone, some will be behind. They all still could be normal. It's just a guideline. And by using those guidelines, we get some sense of where the children should be, but we can't overreact. We can't get too anxious. If there is an issue, it will become over time persistent issues that we will know about, and then we really intervene as soon as we can. So we'll talk about these domains in terms of cognition. We'll talk about receptive language, understanding language that's being told to the child, expressive language, being able to speak, of course, problem solving as they arise with issues in their environment. How do they solve them? How do they adapt to be able to understand them better? So those three will be really cognitive development. Then we'll talk about gross motor development, very rough motor development, to then fine motor development later on. That's going to be the motor component. And then again, social emotional, how the child gets cues from a social context, how the child interacts with family and with the parents. So let's start with cognitive development with our little baby Einsteins. So cognitive development is the foundation, of course, of intelligence. It's the ability to learn, to understand, to deal with new situations. While it's not perfect in adults, we use standardized testing to IQ tests to measure relative abilities from one individual compared to the society in many different domains. But these tests are limited in infants. They really can't perform the same as adults would, and we don't get a really good window into what they're like intellectually. So we look at specific domains, things that children can show us, like problem solving and language ability. So problem solving really starts with this understanding of causality. That means that I do something, it influences the environment, and it changes something because of my actions. The child needs to start to understand that. They need to understand that the problems that arise, I have a way of interacting with those issues to then solve them. And as the infant discovers that she can use herself and interactions with the environment or objects per se to their benefit, She can learn to use her voice to make her parents respond to them. She can express what the child wants as a result of their action, that causal relationship, action, reaction. And this really, on between 4 and 8 months of age, the child really begins to purposefully repeat effects as they learn to get what she wants. The baby realizes I cry, mom comes every time I cry. So let me cry because I want mom to come right now. So that is kind of that relationship. By 4 to 8 months of age, we should start seeing children doing. As we get older, we're able then to kind of have this symbolic thinking of my action is representing another. I have this this kind of play time where I'm able to think of my block as a car and drive, the car on a road like I've seen my parents do in the past. So not only the causality of it, but then I'm able to represent the world within my mind as well. And my mind can be a kind of window to what's going on around me. As they learn this causality, then problem solving arises. Problem solving is the manipulation of objects when the children learn that they can manipulate objects to achieve a specific goal. An infant's first exploration to our environment is performed visually. Infants can start tracking very early on. They follow something with their eyes, whether it's the parent's eyes or an object that's coming across their vision. And by about 3 months, this can be done in a complete three-dimensional circular motion. So their interaction, knowing that I can look at something and I can track and understand what's going on with it, is the first start to problem solving and the first start to causality. Then at about 5 months of age, really focus is even greater on very, very small objects. And then as a result of seeing these objects, recognizing them, understanding the causality they have on the world around them, they then can now problem solve and manipulate objects. This Cheerio is on the ground. I am hungry. I can reach my hand to pick it up, put it in my mouth, and eat it, and now my hunger will go away. And then even more refinements. The children will be able to isolate their pointer finger, and they can start interacting and feeling and touching things by poking or whatever it may be. So this is kind of one domain of problem solving that the children can develop. Another important thing that I'm sure everybody's heard of is object permanence. And this is another milestone that we should look at, that infants, are not just passive learners. They're very active in their observation of the world and how they modify their environment. As we all know, when a baby cries or reaches for something. And as the child learns, they understand that there's this component of disequilibrium of assimilation. Things are happening outside of me in the environment that I don't understand, that don't fit with what I expect, or if I have no expectations, then I don't understand what this is. So they need to first take in that information from the environment, and then they accommodate, they change their mental structure, their idea of what this thing or occurrence or event is, to then make sense in terms of, oh, this is what's happening. Now let me store this information so that I can better understand in the future if I see something similar. And that, again, is a very active process of them learning. Object permanence falls along those lines. Around 9 to 10 months of age is when we should start to see this, is that children will understand that even though I don't see a block or an object or my parents, I know that they're still there, they're still around. And the infant then begins to understand that the mother still exists even when she's not visible. And then as they get older, they can try to reason how I want my mom to come back because I cry and I want to see her come back. By 15 to 18 months, then this idea of object permanence becomes more mature. And then the child will go look for the mother, will go find them based on new motor skills that they develop. So all of this is the ability of the child to kind of interact with the outside world, understand that they can have a relationship in terms of influencing the outside world. And then they start taking in that information, refining it in their minds to understand what they're seeing, to then create much more of a mature structure to the thought and interaction with the world around them. Now, as we kind of shift into language, we have to know that language is this similar interaction with the outside world, but it's much more specific. Language is a broad concept, but that involves the representation of thoughts and ideas using culturally agreed upon signals or words to exchange these ideas. We have to not fall into the trap to think that language is only the production of language or expressive language. Infants can have a wealth of understanding of language without ever speaking a single word, and that's called receptive language. Expressive language is making words and sounds to the outside. Receptive, or taking in information, is listening to things to understand that word or whatever it may be, then to respond to it. So really, this is a very good indicator of intellectual ability, of cognitive development, of course, and it is related to reading skills later on in life. The more advanced children can be with language, makes sense that as adults and older children, they'll be more adept and more intelligent in terms of their reading ability. Speech or vocal communication, again, is only one form of expressive language. In addition to receptive language, there can be a lot of our language that is nonverbal: gestures, manual signs, facial expressions, body postures, pictures, diagrams, and symbols. The production of speech is a specific motor skill. It requires complex control of the mouth and the tongue, but is not the only way that language can be expressed. And of course, other receptive language is very important. Impairments of hearing can also impair speech. A hearing impaired child using sign language can demonstrate perfectly normal expression of language without speech, and that does not mean that they're in any way delayed in terms of their language or cognitive ability. Receptive language, as we said, is the ability to understand language, to receive it. It is evaluated most often when a child is questioned or asked to do something. But we have to take in different components to it. If a child is asked to go walk and pick something up, but they can't walk yet, that doesn't mean they're not receiving the information. It just means that maybe their motor impairment is not allowing them to show that they hear the language. So really, a useful method is assessing receptive language is to ask the child how they respond to their parents. When their parents say their name, do the children look over to them? Do they stop doing something when the parents say no? And we really should see this by about 6 months of age, that when language can be received, that there starts to be some interaction, some change in behavior to show that the children will understand this. And again, it has to be individual specific. If a child that doesn't have any hearing is able to get a hearing aid and starts hearing words that are coming from the parents, they can get back on track. They're not going to lose any ability to understand language in the future. But if they don't get that, they really do need that environmental exposure, then they can be delayed. So we have to be aware of this cognitive ability on an individual basis and meet the needs of an individual child. And then, as parents, we want to facilitate the children's ability to receive language. Read to them. This is such a great way to promote complexity of language in the future. So read to them, allow them to be exposed to different languages, to hear your voice, to hear other languages from other individuals. It's only going to help them refine their development of language in the future. So language milestones, really, as we said, communication happens long before they speak the first word. Crying is really the first form of communication. We shouldn't discount receptive language skills, also present at birth. A child can show a preference for voices in their parents and interest in faces, and will begin to turn towards sound. Expressive communication then progresses with cooing, babbling, and then there's a trial and error process where the children make vowels, make consonant sounds. They put them together. They say mama, dada, around 9 months of age with some variability. By 12 months, we get the first words. We can point to communicate a request. By about 1 year and 3 months, we can say no with a head shake, with representations of movements, and can repeat words and even mimic sounds in the environment. As we approach about 2 years, an understanding of pronouns, me, you, start to come, and vocabulary expands to about 50 words, and two words combined together. By ages 2 and 3, we continue to increase, get 3 to 4 words of phrases in length. And then by 4 to 5 years, language really becomes understandable to anybody. It becomes much smoother and can express much more detailed thoughts and ideas. So again, do I have patients where the children are not speaking by 2 years? Absolutely. My own niece, she didn't speak until 2 years, is one of the top in her class of, for language comprehension. It's not just about creating words. Some children just take longer, and there's a very complicated process to make sounds and make words. It's about receptive language, understanding that the child can respond to language and can take in the information and process it. So that's the bottom line for this portion. When we get into red flags, these are some of the things that will be important. Again, we'll see these slides available for you guys later. You don't need to write these down. But, if by 2 months we're not tracking with eyes, there's a little concern there. Fixation, I guess, to look and keep your focus on one object by 2 months, by 4 months, again, that tracking. By 6 months, not showing a response to sound. That should be a little bit of a concern. By 9 months, not babbling at all. Again, within the variability of different individuals, that should be something just as an average point. By 2 years, should say a word or so. And then by 36 months, not saying 3-word sentences. Again, those could be indicators of some delay in cognition or in language production. So let's get into motor, which is, again, intricately involved in all of these components. Motor movement is really gaining independence and volitional movement to explore the world around them and to travel. Several reflexes are present early on, and when those reflexes are there, they prevent the development of movement as the child wants to move. So really the reflexes need to be downplayed, need to go away so that it opens up for the child to start making their own intentions of movement. And it usually happens about 6 months of age. Just very briefly, some of the reflexes, if you take an infant, lift them up by their hands, and then let them slowly come down back to the bed, you get this Moro reflex. It's a startle reflex. The arms and legs come up. The child is a little uncomfortable. They kind of have this response of falling as this kind of startle reflex. And as this goes away, the child then can have more intentional movements based on discomfort with their positioning in the world. This asymmetric tonic neck reflex is really when you kind of rotate the head, the arm tends to extend on that side. You can also get some movement of the trunk. The other arm contracts a little bit. Just kind of reflexes. They don't control this, but as these start going away, more controlled movements arise. And then finally, this positive support reflex. You lift up an infant, you put them close to the bed where their feet can touch the bed. They kind of extend their legs as if their reflex is to stand. This isn't an actual baby trying to say, I'm going to stand. But over time, as this reflex goes away, they will start to be able to stand on their own. So this just shows as the primitive reflexes go away, as they start to go away by 3 months, by 6 months, they're almost all gone. By 9 months, they should be significantly gone. You get this intentional motor movement, intentional control of their torso and their body to sit and stand in certain positions. They override the reflexes over time. So, by about 9 months, we should see some pulling to stand. We should see some ability or attempts to walk by about 12 months with variability, of course. During this first year, the infant becomes able to move from lying down to start to roll over, to start to get up on hands and knees, to crawl, and ultimately coming to seated position or pulling up to stand. That second year, really, you get much more refinements of the movements of the legs. They can start moving backwards, running, jumping can be seen. And then even when you get on further beyond there, you're getting better balance, better coordination, and this kind of wide-based, really kind of awkward staccato gait we get at 12 months really becomes smooth, upright, narrow gait that we would see, in older individuals by, 2 to 3 years of age. So these fine motor skills really involve, fine motor skills then are even more detailed. We have these primitive movements of the arms. We have some initial attempts to start walking. These fine motor movements, we're really going to focus on the hands. At first, the arms really play an important role to let the baby start to sit up and balance and support them. These are kind of gross movements of the hands. But really, when they start to explore more, they start to roll, they start to grab things to start to pull up, then you're getting really fine in terms of the details of these movements of the arms. At birth, they really don't have this volitional control. You put something in an infant's hand, they will close the arm. That is no way an intentional movement. It's a reflex. The more intentional, much more difficult thing to show that there's intention there is to let go. That's not a reflex. That's much harder to see. So, gradually as this primitive grasp reflex goes away, the infants in time will start to grab things intentionally. They'll first start on the hand towards the pinky, and they'll start to grab at about 5 months of age, and then more fine movements to the first finger and the thumb by about 7 months of age. And then again, this release, that's much more of a complicated movement to release their hands because of the reflexes to grab things and close their hands. Usually it'll start also about 5 months of age as they're becoming more refined. And then they'll be able to kind of release from one hand to the other or to their mouths by about 5 to 6 months of age. Then as we get on between 6 months and a year, it allows the children to really grasp for objects of different shapes, to accommodate their hand movements, to grab different things of different shapes and sizes. The thumb becomes much more involved. The child is able to grab the thumb and all four fingers at about 8 months of age, and then two fingers, just the pinky, this is the forefinger, the first finger and the thumb, this pincer grasp by about 9 or 10 months of age. By 10 months, they can release the cubes into a container, and they, by a cognitive object permanence, they understand I dropped the cube, it's still there, it'll come back to me. And then by the second year, they really master this. They reach, they grasp, they release, and they start using objects and tools. And this fine motor development becomes really a driver for how they understand and adapt to the world in terms of their cognitive development as well. By 15 months, they can release things by stacking them and having the control and the balance to be able to put one block on top of the other. They start to adjust their grasp to then properly pick up crayons, to scribble something by about 1.5 years. And close and coming up to about 2 years, they start being able to use a spoon consistently to feed themselves. And then as they get on, they can draw, explore, problem solve, create, using their hands, using their motor ability. They can have a 6-block tower by about 2 years. They can feed themselves consistently. They can turn a doorknob. And then, as they get even more involved, they can start rotating objects, opening a bottle, start moving a puzzle piece to put it in place. Again, that's cognitive development, working through motor ability to then solve this puzzle. And then by about 3 years of age, they can draw a circle, put shoes on, stack blocks. So that's really kind of this slow development of their motor ability over time, which again, as we say, is very much linked to their cognitive development. Red flags by about 4 months, not able to hold their head in place, not able to have that kind of gross motor movement. By 9 months, inability to sit, and by 1.5 years, inability to start walking. These are kind of some red flags. Again, variability is key. Some individuals will take longer. If a child has a muscle problem, again, these things can be totally different. And it doesn't mean that they necessarily are developmentally delayed in terms of their motor development. It just means they have another condition which makes their motor development slower or more difficult. And then finally, we'll talk about social emotional development, interacting with peers, with others, playtime, and then how the children interact with parents. So most children are born with this. Again, they have an inherent drive to connect with others and share feelings, thoughts, and actions. The earliest milestone is bonding with caregivers, and that's reflective. It's a two-way street, how the parents respond to them and how baby understands the parents will respond to them in time. This attachment theory really suggests that the caregivers respond to cries, other behaviors, and then the infant gains confidence that their caregiver will be accessible to them and responsive to them. And this is just a back and forth. This provokes the parent-child relationship, and it facilitates that the parent protects the child and helps them survive when they're very much at will of, and unable to fend for themselves. From this relationship really becomes the first social milestone of interaction, the smile, which I'm sure is extremely rewarding to any young parents that see their infant smile for the first time. It's the first in response to high-pitched vocalizations, baby talk, smiles to the caregiver, but then over time, the infant learns their smile is a outward show of what they want. And ultimately, just seeing their caregiver can give a smile. But then they learn that they can manipulate the environment. Their interaction with the environment can satisfy their needs by flashing a smile and saying, I'm happy with this food that you're giving me or what you're doing right now. Or conversely, by crying, I'm unhappy, this is not what I want, give me something else or do something else for me. And then these interactions are back and forth. They begin to evolve. Then they then move to more complicated vocalizations, as we were saying. As visual skills develop, the infants can recognize their caregivers by about 5 months and then start interacting with them with initially cooing, different sounds, crying, and then it becomes more and more complex. This other social developments also are stranger anxiety. I mean, we've all seen this at about 6 months of age. Children who are very smiley and happy with unfamiliar or even some familiar people become very scared and apprehensive and shy away from individuals that they're not comfortable with. And this is a normal process by about 6 months of age. Joint attention is another development of a social milestone that for children. It's really this idea that they have attention with their caregivers. The infant and caregivers share an experience. The infant will start looking in the direction by about 8 months of age of where their caregiver is looking, and they'll have a joint experience together where they'll be able to understand this interaction. And a few months later, after about 8 months of age, about 10, 11 months, the infant will look back at the caregiver and they'll share the interaction, making that eye contact later, saying, hey, we saw the same thing. Wasn't that really funny? And start to interact together in that way. The infant will then turn their head when there's a speaker, when their name is called by about 10 months. And it's further showing a connectedness and an understanding of language as everything is interconnected, as we mentioned at the start of the talk. Then between about a year and 2 months, children begin to point to request to something. This is called proto-imperative pointing. And then it becomes this proto-declarative pointing, pointing to something they want by about a year and 4 months. Saying, oh, there's food, I want that, I'm going to point to that. I understand that you're going to see me pointing, that you're going to react to me pointing, and you're going to bring that thing to me. A very complicated process, but we talked about all of those little components. And as they all build together, they become more sophisticated, more detailed, and more complex as all of the things come together to understand this seemingly simple, but a very complicated process that the infant is showing us. And then by about a year and a half, the infant is able to bring an object to his or her caregivers to share the experience. Look at this toy. Look at what I've been able to bring to you. And again, that requires motor ability to be able to pick up the object, to walk to the caregiver. That requires cognitive ability to say, I have something here that I love, that I think is great. And I love my mom so much, I want to bring it to her and I want to show her this because I want us to both enjoy it. Well, that takes a lot of refinement of movement and action and thought to be able to get there. Play skills is another social construct, another social way that infants can develop. It shows that initially the infant will just take blocks, will throw them around individually. Then by about a year and a half, they can do some pretend play using miniature representations. This block is a car. I'm driving down the street just like my mom or dad does. And then by about year 2, they can start interacting with others. So whatever their age is, this should be the number of children that they can interact with. But, at 2, you just have 2 kids that are playing in parallel. They're next to each other. They're not necessarily coordinating what they're doing. And as a result, they can't really communicate so well. If there's an object that both like, they will fight over it. Aggression can result. So they're not able to really play together, but they play kind of alongside each other. As we approach about 2.5 years, 3 years of life, then they can really kind of form this complex pretend play in the context of others, of other children, and then can kind of work together. And then really by age 3, they mastered preventing this aggression from, having something that others have. They're able to work together, cooperate, and they are able to kind of play together. And most of the time, they have goals that what they want to achieve during their play together, and they're able to take turns to allow others to go. So, that's kind of the social environment of how children develop when they should be reaching these goals. Now we get to the last portion of kind of emotional development. With the development of these social skills, the child's emotional development is very important. Even at birth, the children demonstrate individual characteristics and patterns of behavior that really make what their temperament is. And the temperament is how the infant responds to routine activities like feeding, dressing, playing, going to sleep. And there's really a component that's biological, hardwired in our brains of how children will act and how easy or complicated they will be, how they'll tendency to cry or just to be easygoing. And then really, then later on, as they kind of get information from their caregiver, as their cognition, their intellect evolves, they can kind of modify some of these early temperamental, like hardwired things that they experience. And then, as it develops over time, it's really kind of this emotional development is a three-step process. The brain relaying information from the outside, a mental process that generates how do I respond to that? How do I feel as a result of that? And then the outward show, movement that shows either facial expression, language, or purposeful movements that demonstrate what my feeling is about this information that I just received and that I processed in my mind to create this outward show. At birth, we can get anger, joy, and fear. That's pretty much the spectrum of our emotional development. All infants have a universal facial expression that reveals these emotions, and they can use them to demonstrate what they want by about 3 months of age. Even really unfortunate children that don't have complete formation of their brains can still show facial expressions that demonstrate these behaviors. It doesn't take a full brain to do that. And that just shows how much of this behavior can be hardwired in our very, very primitive brains. Eventually, however, their cognitive skills allow them to demonstrate more emotional expressions, more complicated emotions. And about 8 months of age, children can let their parents know when they're upset about something, when they want them to be happy, when they want them to come to their crib, to be there, or about when they're happy with a toy or food or whatever it may be. This emotional development continues as they learn to understand others' emotions. And then by a year and 3 months, the child develops empathy by looking sad when others are sad and develops the self-consciousness of their emotion, that they understand my emotion has to be in the context of the world around them, and they can modify their behavior if they think it's inappropriate. They don't want to, they start to get embarrassed by having an accident or whatever it may be, and they then understand how that frames in the context of the world around them. So during the preschool years, as they get more and more advanced, they can learn how to manage their emotions better in any given situation. They demonstrate increased understanding and the use of display rules. And these are culturally defined rules that guide a person's decision to alter emotional behavior consisting with the demands of the social context. And that means that, I'm at school, I can't do this. I can't expect my mom's going to be here. I can't expect that I'm going to be able to sit at home and watch TV or whatever it may be. They kind of understand their context, the world around them better, to then express their emotions in a more context-specific way. And by the time they're in kindergarten, they become masters of this emotional nuance and social interaction. By about 5 years of age, they've been living in our world for that half decade. They see the interactions every single minute, every single day of what they do, how it interacts with the outside world, and what the outside world gives back to them. And from there, they can modify their social interactions and their emotions, even in a very masterful type of way, even that early. So just to conclude for social emotional development, some of the red flags: by about 6 months, lacking smiling or other outward expressions of joy. By 9 months, lacking this back and forth vocalization, smiling, interaction with the caregivers. By about a year, not able to respond to their names, not able to babble, and not able to show a response to the outside world. By a year and 3 months, this pointing of what I want, by using a single word. By a year and a half, pretend play, unable to have a language, either outward or an inward understanding of language. And about 2 years, not able to say these 2-word phrases to express their meaning and emotional state. And then even on in the future, any regression of symptoms of development is symptomatic, is a problem. I mean, this doesn't just relate to the social emotional development, but anything. children are using their right hand to grab things, and now they're not, and they have to grab things clumsily with their left hand. They were previously walking, they're not. They're previously talking, they're not. They're not responding to their name. Any regression as an overarching theme to this talk, any regression backwards is concerning and immediately should be evaluated by a physician with their parents being involved. So that's kind of one overarching thing. And now we've really gone through a very detailed spectrum of what the normal development should be. I hope I relayed the idea that one task, as it gets more complex, is built on the pieces of all of the less complex things that happened before, that all of the streams of development are interactive, and all of the really more detailed things that happen on are interrelated to the less detailed and more kind of rough movements and actions that happened before. So it really happens in stages, building one onto the other. And when we use the guidelines of what the expectation should be, when those things are not happening in a child, there is a concern of developmental delay, and then kind of wrapping everything up, that anything going backwards obviously is going to be concerning. Now I have these slides. This is exhaustive of what motor, fine motor, self-help, problem solving, social emotional, receptive, and expressive language should be. This is going to be a reference for you to look at later on and for specific details. But going into the details of every single thing that should be done is beyond the scope of the talk, is a little exhaustive, but will be kind of a guide for reference later on. We kind of hit on the major ones, the things that are very clear to see, and allow, really kind of pretty specific time points for expectation for those things to be seen. So I'm just going to, leave these slides up individually for others to pause the video later on if they want to read about any of these specific details. But really, we kind of went over the broad overview of everything. We talked about how interconnected everything is, how it follows a stepwise pattern, and how everything should be moving forward, and how also we have to take the individual patient into account of, hearing impairment or cerebral palsy, God forbid, about inability to move intentionally or not. All of these things need to be on an individual basis. And by taking that account into for the individual, we know that there's going to be a wide range of when things should happen. And the guidelines, again, are only a guide of the average. So keep that in mind. Otherwise, we got to support the development of these brains for these young doctors, scientists, whatever they want to be in the future. We want to make sure that we're supporting them. We're giving them a rich environment to work around, with lots of stimulation, with lots of feedback, with reception to the infant when they want something. You find a fine line. Every time they cry, you don't want to run to them. You want them to be a little independent, but you do want to have them be comfortable to know that my parents are here, that I'm in a loving place, that I'm going to be supported. And that just makes them develop better and more, confidently in the future. And again, they are just beautiful little lumps that are sitting there. We have to provide them the stimulation. We have to read to them. We have to show them what they do has a consequence to it. We have to move their hands, show them to grab things. It's on us to really prevent problems and support the development, and being aware when there are issues arising. Bring it up to your pediatrician, bring it up to your local neurosurgeon early on, so that any intervention that needs to happen, therapy, speech therapy, occupational, physical therapy, whatever it may be, can happen early on, and identify any problems before they become consistent. So with that, I really want to say thank you for the invitation, for the opportunity to speak with everybody today. I think it's a wonderful topic to be very comfortable with, because there's always going to be questions among family, among friends. Hey, my child is doing this and yours is doing that. What's normal? Is this okay? Should I go see a doctor or not? Feel free, send me an email, call my office, happy to discuss it. Again, just thank you. And I hope all of our children are developing wonderfully, and that I've helped shine a little light on this topic for you. So again, thank you very much. And with that, I'll end my talk.
Thank you so much, Dr. Kovets. This is really enlightening. And as you said, it's a lot. It's, as a mom, it's hard to keep track with everything. And you're right, especially first time moms, they might have a lot of questions about what's normal in a child, especially because there are so many kids that develop at different speeds. And you just said that, it's like, this is kind of the guidelines. But if your child doesn't fall within those guidelines, it might be okay. So we don't have to worry. That's why we have Dr. Kovets. Let him worry for us, as I will say. Sorry to put that weight on your shoulders, but
I'm not a worrier because I'm not a worrier. I think worrying arises by not having that information, by not knowing what to expect and what's going on. And that's why I hope arming everybody with this knowledge will prevent them from being anxious and stressed about it. And when there is a concern, again, don't be anxious, don't be stressed about it. Find somebody that can help you get through it, and we absolutely will. And know that everything will be okay, no matter what. It always is.
And I love what you're saying. Look for the opinion of an expert, because sometimes we go to the neighbor. If I'm bringing my child to the kindergarten, then I'm going to go talk to those moms around there, and children are different. And then oftentimes, as moms, we get more nervous because they are like, oh no, mine did that months ago. Or like potty training, like, oh no, mine was potty trained at 9 months. And we're like, what? So it's good to have you. Thank you so much for that. And this is the time where I'm going to ask our attendees, please, if you have any questions, share, use the Q&A, use the chat, send them to me. I'll be happy to read them to Dr. Kovets. And in the meantime, there is a question that I have for you, and it's related to technology. And I might say it's two different questions. I feel that now with tablets and phones and all of that, two things are happening. When I go to a restaurant, I see a lot of the parents just hand the phone to babies, and I don't know how good that is. And the same thing with the parents. They bring the children to the park, and the kids are like waving to their parent, and the parent is busy on the phone and not looking at the child. So why don't we talk about that a little bit? Because I don't know, for some reason that concerns me.
Sure. No, that's a great question and very valid concern. I think the second one about the parents being on their phone too much, easier to answer. Obviously, children will get into trouble. They're all little troublemakers. So, if it's something important, obviously you got to attend to it. But, we have to have our attention on them all the time. 1 second can be the difference between something bad happening. On the flip side, on the point of the children being on tablets, it's a very nuanced and complex issue. Does it allow the parents to have a moment of freedom? Yes. Does it provide some meaningful stimulation in terms of intellectual development for the child? Yes, it actually does. And, I'm a product of playing computer games, and for, Commodore 64, 40 years ago, we did have one. And, I had a game that taught math, and, it is stimulation that is not as good as, the environment around us and learning about the world around us, but it does provide some meaningful education for the child, whereas otherwise they would be sitting around and looking, in a waiting room at a wall where they could be learning, they could be read to, they could be doing math problems. So there is some benefit to it, but it's like with everything, anything in excess is going to be problematic. And, we think that we're in this internet age and this is a unique problem we have. It's not. I mean, parents are having the same issues with televisions and having the kids sit at home watching TV all day versus going outside and playing with their peers and having that social, emotional kind of interaction. So, there are positives to it. It does facilitate some cognitive development. Our kids are going to be a lot smarter than we are because they have this new input of this really detailed technology. But again, it can't supersede just being a kid and going to play outside and enjoying the world, because then, that's all they're gonna know. They need to have those experiences. One tiny little caveat that throws a wrench in the gear of these things is that now more and more jobs in the future and more of our lives in the future are going to be based on tablets and smartphones and all these things. So it's hard to say that they shouldn't be using them because it can have a significant impact on their future. Maybe they're going to be, working as a computer scientist, and that exposure early on could be beneficial to them. But with anything, it just should be in moderation. It shouldn't be at the complete expense of being a kid and running outside and getting dirty and playing with friends like that. That should be balanced between the two. But I don't think we should see this technology as only a negative thing. When controlled and when properly done, it can have impact to benefit the child in the long run.
Okay, that's good to know. So I guess the message there is within limits.
Yes, as with everything.
Yeah, yes. Okay. And here is another question. You were talking about action reaction and how the kids cry and the mom comes, or you bring something and the mom smiles, so you keep bringing things. What about tantrums? How do we manage that?
So with any behavior, it's conditioning. The child will learn this is the causality of their behavior. I do something, this is the cause, and then the effect I will learn by doing this 5, 10, 20, 50 times. So if it's a maladaptive behavior, which doesn't help promote their intellectual development, doesn't help them promote an emotional or social bond with the parents, then in the same way, we need to modify behavior because the children don't know what they're doing. They don't know this is a maladaptive behavior, and they don't know that in the future, this can cause problems with their development and their emotional states. So it needs to be a situation where the parents downplay their response to that so that it becomes unlearned, and they don't reinforce that behavior when they deem it not to be something beneficial for the child. So again, we're constantly molding, and they're constantly looking at what the consequences of their action are. So when we don't think that it's a positive action or behavior that they have, we mold it by downplaying the response that we'll have to that.
Mm-hmm. And I think my next question is related to that answer as well. You also mentioned, the kid might be progressing very well, and then all of a sudden it starts to reverse. So what are some of the causes for that?
Well, that could be a sign of something seriously going on in the brain. That could be the worst case scenario. There could be pressure building on the brain. There could be, a malformation or something that could be going on that could be worrisome. I don't take those lightly. I'm not an anxious doctor when I talk to my patients. If anything, I try to bring stress levels down more in mom than dad, but that's life. I'm very kind of anti-stress for the parents with minor things. But I do have to say one thing that I am worried about, and rightfully so, is the regression. The process of development and maturing, how children interact with the world should be straightforward in terms of going in one direction. When it starts going backwards, there is a concern that something major could be going on. So with that, I would have the right amount of stress and anxiety. And I say, don't downplay that. That should, on the first indication that something like that is happening, talk to your doctor right away, because it never should go backwards. Something could be going on that could be treatable. So that's a very important point to make. And thanks for bringing it up to reiterate that.
Mm-hmm. And we're talking about something physiological here, but could the reason also be emotional? And I'm just thinking, a lot of moms nowadays have to work, and you leave your child with a childcare center or a caregiver. If there is abuse, for example, abuse could be one of the reasons as well. And that's what I mean, physiological or emotional or psychological.
Yeah, I mean, if the child is now withdrawing from social interactions where otherwise they would be open to them, yeah, but that's again, you're right. It doesn't have to be an anatomical, it doesn't have to be a brain-based issue. It certainly could be a negative issue from the environment, from their social interaction. All of those are maladaptive, and all of those will show a backwards development, and all should be treated. So whether it's something treated within the body or something treated outside of the body, all are going to show the same way. and all arguably are concerning.
Yeah, so that's a very concerning response, I will say, and I don't like to end on a concerning note. So let's end on a positive note. Thank God we have Dr. Kovitz now to help us with our kids. So thank you so much for being with us today. Thank you for our attendees. Don't forget to tell your friends that now this recording will live in Montefiore Nyack community chats in YouTube. Spread the word. Help other moms and grandmas and parents in general with this very important information. And next week, we're going to be talking about the opposite side of life, seniors, and the work of senior centers and what they used to be and what they are now, and to see if they are a good option, I guess, for us when we grow older, our parents, our grandparents. So don't miss it next week. Dr. Kovitz, thank you so much for all the information. I wish I had known that 20 years ago before I had my daughters. Thank you. And thank you to our attendees. See you next week. Bye-bye.
Thank you again. Bye.